All right. So, so as not to waste anybody's time, this in some ways perhaps would have been a better discussion maybe to be had at the beginning of the summer because it seems like so often is the case when the summer rolls around, ear infections seem to spike, at least in terms of the numbers that we see on a weekly basis. And the first thing I wanted to point out, and I think this, we oftentimes discuss this in the rooms. I think it sometimes often goes overlooked, but yes, there are times when a dog gets an ear infection. For example, we have a dog, let's say your classic Labrador, goes in the pool, makes a habit of going in the pool, every day during the summer months, and this water pools in the ear, and the moisture is retained, they have floppy ears. And of course, it becomes a great sort of ripe environment for things to grow. But what we have to recognize is, especially in a lot of patients, is that while you can have a dog here or there gets an infection and it's no big deal, it's those patients that start to develop a pattern, where they're starting to come in with more frequent infections. And we're forced to ask at that point the question, what underlying causes could actually contribute to these ear infections? And that's kind of where I wanted to start tonight, because so often is the case, especially in Arizona, where we have, for example, allergies as being so prevalent. And this is one of those key things that really sort of puts a lot of dogs at risk. And again, when we talk about ear infections, for the moment, we're really talking more about dogs and cats, because while we do see ear infections in cats, they're far fewer. The numbers are far fewer than what we experience in dogs. And so one of the first predisposing factors that, of course, we want to talk about is lifestyle. This goes along with, living in Arizona, having pets that swim, for example. Moisture, any retained moisture in the ear is obviously conducive to the growth of bacteria. And as I'll point out, sort of touch on at several points, when we talk about dogs getting ear infections, these are not infections that are acquired from the environment. They're not, one dog is not getting the infection from another dog. They're not picking it up from the soil. They're not picking it up from the environment. More often than not, the bacteria and yeast organisms that typically cause infections in dogs, they live there, in very small numbers. And for the most part, they don't grow out of control, and therefore they don't elicit a lot of inflammation, pain, discharge maybe in the form of pus, nor do they produce, excess amounts of earwax. But if the environment changes in some way, say, for example, the dog, again, is swimming and retains a lot of moisture in the ear, you change that environment, giving these organisms a chance to regrow, beyond the body's ability to control them. And of course, if that should go on unchecked, that's when we see pets develop, different types of ear infections. So environmental factors, certainly, when we used to have monsoons and it used to get hot and humid, that was a period when we also could see dogs who had, ear infections because of their lifestyle, where they lived. Perhaps you could call that a little bit more environmental. And of course, there are other environmental factors. I can tell you, for example, having a pug here, oftentimes, my kids take the pug into the shower and his ears get wet, and of course they don't get cleaned properly. So there's a lot of things that can happen we may not think about on a daily basis that could contribute to the formation, that are either environmentally induced or caused by a certain lifestyle. I mentioned the pug, but it's kind of a segue in the sense that there are some anatomical factors that we oftentimes need to consider. Now, when you have a very large breed dog, whether they have floppy ears or ears that stand straight up, the ear canals are fairly large in diameter, so there's decent airflow, and they can be kept drier. Oftentimes, in the case of the smushed face breeds, for example, or a great example would be the Cocker Spaniel, either because of the way they're born, like in the case of a pug, or over time, because of, let's say, a genetic predisposition, the anatomy of the ear canals can change. So, for example, in situations where you have recurrent ear infections, you can cause a lot of thickening and narrowing and extra tissue to develop in the ear canals. So they become much more narrow. There's not good airflow. You have, material, moisture, wax, what we call ceruminol, can get trapped and, create a reservoir for things to grow. In more extreme cases, obviously, when you've had a series of infections, you can also see a situation where you get increased sort of activity, production, and actually an increase in size of a lot of the glands that actually produce wax and other types of materials in the ear, which again can, predispose you to ear infections in the future. And in extreme cases, you can get situations where ear canals actually, kind of begin to close up. And of course, when we get to that point, medically speaking, we're rather limited. And this is oftentimes when we sort of gravitate to like the surgical options, which we'll touch on a little bit later when we get into treatment. But another sort of category of conditions are what I'll sort of term physiologic, things that, in other words, conditions in the body that could make the environment in the ear a little bit more conducive to the growth of bacteria and yeast. And I mentioned one earlier, and that is, having environmental allergies or atopy or even, food allergies. Oftentimes when we talk about allergies, certainly allergies in people, we're thinking about hay fever-like symptoms, but anybody who's experienced these in their own dog recognizes the fact that they affect the skin. And of course, the ear is kind of part of the skin, quote unquote. Therefore, we oftentimes see recurrent ear infections as a consequence of allergies or atopy that goes uncontrolled. Same thing with food allergies. And to be fair, even when the allergy is fairly well controlled, it's still something that a pet can experience from time to time. Historically, certainly there are diseases of what we call the endocrine system. For example, the endocrine system includes things like the adrenal gland, thyroid diseases, for example. When a pet has some of these, it may change the way, for instance, the immune system responds to the infection. Again, most of these diseases, while they may start in, let's say, one organ, they affect the whole body, and that includes the skin and the ears. In fact, if you think about all of the organ systems in the body, the skin as one organ is actually the biggest organ in the body. So certain types of endocrine conditions are another good example of conditions that could predispose you to recurrent ear infections. Excuse me. And of course, there are some, sporadic things here and there. You can get objects stuck, for example. You can have other types of traumatic injuries, perhaps, that occur that change the anatomy. But basically, when we're talking about the predisposing factors for recurrent ear infections, things that, again, are not sort of one-time events, we're talking about changes within the body, so physiologic endocrine diseases. We're talking about a certain type of lifestyle or environmental factors, for example, like swimming in the pool, living in a hot, humid environment. Sometimes even just having really floppy, droopy ears is enough. And then, of course, there are other things. I mean, some dogs, for example, just produce a tremendous amount of cerumen in the ear. That cerumen is a term we use to describe the sort of wax-like materials that dogs produce. We produce the same thing. We call it earwax. And again, if that material builds up, it creates an environment where these organisms can begin to get a foothold and take root. And of course, both because of the way you're born, say in the case of a pug, or in the case of, let's say, a dog who's had chronic infections, a change in the anatomy of the canal is one of those predisposing factors. And of course, this sort of lends itself to a discussion we'll get to a little bit later in terms of how we approach the problem, both short-term and longer term. But before we get there, I did want to talk just a little bit about the diagnosis. And I think you can kind of break the diagnosis up into two parts. We obviously want to diagnose what's causing the infection at the moment, but we want to identify if there's some underlying cause, some physiologic cause or anatomical issue that would predispose you in the first place. So there's really two parts. Now, for the active infection, the thing that we most commonly do is take a sample. And sometimes people wonder, why do we even bother doing this? Well, there's many different types of bacteria, in fact, that can actually cause the infection. Certainly, we have some culprits that are going to show up a little bit more commonly. Staph, strep species, there are certain what we call rod-shaped bacteria that can occur, things like Pseudomonas, Proteus, for example. And the medications that we use to treat these organisms differ. So, it's sort of, in common parlance, people think of an antibiotic, and an antibiotic treats a bacterial infection. But there's different types of antibiotics, and there's different types of bacterial infections. And so there's not sort of a one-size-fits-all approach or one-size-fits-all medication or drug that one can use. So by taking that sample, preparing it in slides, and looking under the microscope, we can get a really good sense of what type of bacterial infection or fungal infection we're potentially dealing with. Now, can you always positively identify the species? No, oftentimes that may require something called a culture. But oftentimes, unless we have a difficult case or a recurrent case, that's not something that we necessarily need to pursue. under the microscope, we can narrow down the type of bacteria. And when I'm saying fungal, we're really talking about yeast, which is a type of fungus. And the most common form of yeast, something called Malassezia, is a sort of a little kind of peanut or light bulb shaped little guy that you see under the microscope. There are others, something like Candida, but you see them rather rarely. And of course, it goes without saying, but I do need to mention it, is that antibiotics don't typically treat yeast or fungal infections and vice versa. So when those situations arise, when you have a combined infection, you have both yeast and bacteria playing a role, oftentimes we need to use a medication that'll tackle both. When we do this, we spend some time quantifying the number of organisms we're seeing. However, you can't necessarily equate the number of organisms under the microscope with the severity of the infection. There's not a one-to-one correlation. It gives us a sense of what we're dealing with, and certainly it's one piece of information along with what we get from a physical examination from you to determine, the severity or the level of concern we have about treating this. But again, there's not a one-to-one correlation, because above and beyond looking for bacteria or yeast, we're also looking for other things. We're looking for the presence or absence of white cells, other types of cells that might be present. Again, in rare cases, you could deal with a cancer of some type. We're looking for the presence of, large quantities of mucus, for example, which, believe it or not, can interfere or affect the treatment decisions that we make. Some bacteria, for example, have a unique ability to sort of form protective shields around themselves, and we need to use special solutions to break that down before the medication can actually get in and go after the infectious agent. So the what we call the cytology is the first step we almost always do in the hospital, even in dogs that have had ear infections periodically. Just because you've had one ear infection and your dog was diagnosed with, say, a staph infection does not mean the next time they get an infection, it's always going to be a staph infection. Most of the material and certainly the inflammation and redness that's produced is similar from one type of infection to the next. So you can't just make that assumption and therefore say go on past information in order to arrive at the correct answer and ultimately treat the infection successfully. Now, if we have to go beyond this, obviously there's a few steps. One of the things that's important is we really need to get a good look in the ear canal whenever possible to see if there's any type of anatomical issues. Could there be some sort of foreign body? And of course, on rare occasions, we're talking about right now mostly external ear infections, but truth be told, there are three parts to the ear: the external ear, the middle ear, and the internal ear. And on rare occasions, the eardrum, which separates the external ear from the middle ear, can break down, and the middle ear can act as a reservoir for future infection. So while it's not a perfect way of evaluating things, that would really look towards a CT there. We can get a sense of whether that may be an issue of concern down the road and something that we need to address differently. Should it be necessary to go beyond that to identify what we're dealing with, this is when we might go ahead and culture, meaning we'll take a sample of the material, we'll send it to the laboratory. They will actually grow and then positively identify the organisms that are present. They will also then test those organisms to determine what antibiotics they are most susceptible to. Again, not usually a first step, usually done in more complicated, difficult, or recurrent infection with dogs with recurrent infections. And again, it really helps us design a treatment protocol specific to that patient's needs. We never want to be in a situation where we're having to use antibiotics or antifungals if necessary. And certainly when you have a pet who has long-standing issues, like it or not, sometimes we can deal with the possibility of inducing resistance, more to bacteria than fungi, or in this case, yeast. But nevertheless, it's a consideration that we on occasion have to deal with. Now, taking a step back and looking towards some of the more chronic underlying factors, this is where we sort of, when we're talking with you guys, try to dig a little bit deeper, understanding the history. When did these infections start occurring? What age? Do they have any sort of companion symptoms that, for example, might lead us to suspect that we have an underlying environmental allergy or food allergy that has to be addressed? Because if that's the case, until we resolve that or manage that, we're still going to be seeing this patient in with recurrent infections. It's not ideal for us, and it's certainly not ideal for you or your pet. So this is where at times we might consider, getting a more extensive history from you. We might consider some blood work, for example. There are certainly circumstances where we may need to consider a more intensive investigation of what's going on with the anatomy of the ear. For example, I had mentioned the need sometimes to do a CT scan to look at the middle ear and see what's going on there. again, in order to determine the most appropriate therapy. But again, and we'll get to this in just a moment, more often than not, when we approach or ask the question about how best to treat these patients, we're doing so using medicine, either something that we would apply in the hospital or medication and solutions that we would send you home with in order to, rid your dog of this particular type of infection. By the way, I forgot to mention, if anybody has questions, you can just, it's small groups, so just, pepper me with them as we go along, or we can talk afterward. So treatment. Everybody, if possible, when faced with this, wants the simplest, easiest solution, and ideally the one that requires the least amount of effort. Renee, I'll pick on you because you have big dogs. If you have a big 150, 160 pound St. Bernard, that may be a tough dog to wrestle at times, to medicate on a daily basis in order to treat the infection. And I only mention that because nowadays we have a variety of options, but the options that we offer and the options that we would recommend are going to differ on a case-by-case basis. Not every option is going to be appropriate for every patient. On one hand, these days, it's not really newer, but one of the more widely used options are medications that we actually apply in hospital in the ear. They're usually medications that have, or rather, they're preparations that have several different types of medications, usually an antibiotic, something to treat the yeast, and oftentimes a steroid. We sort of refer to them as leave-in preparations or leave-in medications. And they're tremendously convenient because after we clean the ears and we apply them, they usually stay in the ear, depending on the medication, say anywhere from about 7 to 14 days. And then we have you come back, we remove the residual medication, and we assess the patient to make sure the infection's gone. It means you're not cleaning the ear at home. It means you're not medicating the ear at home. Obviously, it's a huge convenience. Downsides, while the medications tend to be very, very successful, on rare occasions, you can sometimes experience hearing loss. It can be temporary hearing loss, which is certainly a little bit more common when hearing loss occurs, which again is very rare. But it is always possible that a patient could experience more permanent hearing loss. So that's always a risk, regardless of the type of leave-in preparation that we would potentially use. It's something we mention. Again, is it a likely result of using one of these leave-in preparations? No, but it's a consideration nonetheless. Keep in mind, though, that some of these preparations can be rather thick and viscous, even oily. And if we have ear canals, for example, that are very narrow or tortuous, they can gum up the works, and it may not be the most effective option. Now, an alternative, and something that for all intents and purposes has been a mainstay for many, many years, is obviously sending the owner home with medications. Now, usually when we do this, we do so with a cleansing agent. It's just as important to remove material that's produced, like the cerumen or the waxy materials, to break that material up, as it is at times to disrupt the protective shields that bacteria create around themselves to protect them against antibiotics. So we oftentimes combine the action of a cleansing agent with medication to get a better result. And again, this is a decision that we make on a case-by-case basis. And I'm sure any of you could attest to, there's a variety of solutions out there, and certainly a variety of topical medications. By and large, from the standpoint of the owner, none of these things are going to cause harm to, Sarah, good question. I'm going to get to that here in just a second. None of the medications are really harmful or would put the owners at risk. And as I said, while leave-in medications probably have a higher chance, although still be a small one, of causing temporary or permanent hearing loss, that same risk technically exists with the medications that we send you home with. These days, the medications are designed for, once daily dosing. And again, depending on the medication, it may require anywhere from, say, 5 to 14 days of treatment. We can customize the treatment with medications that we send you home with a little bit more to the patient needs. We can also, if necessary, we have a sort of a spectrum of medications, some of which are thick and viscous solutions, some of which are more, clear and flowing liquids. Sometimes they can penetrate the deeper recesses of the ear a little bit better. So it gives us a little bit more flexibility, and at the same time, having you clean out the debris, and in some cases using a solution that itself can kill off infections like certain yeast infections, can be more effective. And if you ask me, well, gee, how do you decide to do one versus the other? Well, sometimes if this is not a severe recurrent infection, it's a flip of the coin based on convenience for you. Truth be told, I don't think the cost differential is really that significant. But in those cases that are more difficult or recurrent, certainly we may make a particular choice or recommendation which we feel would give you a better result. Sometimes that means more work on your part. Never ideal, especially if you've got a big rough and tumble dog that can make a big mess. But nevertheless, if we're recommending it, there's probably a good reason. Now, excuse me, one of the things to note, and this is oftentimes a consideration that some veterinarians didn't appreciate or didn't respect, is that most of the time we're dealing with infections of the external ear canal. Therefore, in order to be effective, we apply medications directly to that portion of the ear. Unfortunately, systemic medications, for example, systemic antibiotics, have very little place when treating an external ear infection. They have value and oftentimes they're necessary when we're dealing with, say, a middle or inner ear infection, but they really don't get into the external ear where most of our infections occur. That said, it's certainly possible that we could use something like a steroid, even on a short-term basis, given as a pill, to reduce inflammation in the ear canal. But using antibiotics to treat the most common type of bacterial ear infection, which occurs in the external ear canal, is not recommended by dermatologists, and therefore it's not something that we practice. Now, I did mention this earlier, I'll just touch on it. Certainly, there are those cases, I would say that Cocker Spaniels, small breed dogs in general, Cocker Spaniels and maybe English Bulldogs ranking at the top of the list in my experience, who have had so many infections or had so many underlying issues over the years, or started out with anatomy that put them at a disadvantage, where treatment topically is no longer an option. And we do have several procedures. The most common one that's referred to as a TECA, T-E-C-A, stands for total ear canal ablation, where we actually go in surgically and remove the external ear canal. They can still hear. I mean, there's still a little hole through which they hear. But all of that tissue in this sort of L-shaped canal is removed, which oftentimes does act as a reservoir for future infections because we're never quite successful enough at eliminating it. Obviously, it's something that nobody wants to have to put their dog through, but it can be phenomenally successful in a dog that's having chronic issues and really experiencing chronic pain and discomfort because of these infections. But that's an end stage. I guess one could even refer to it maybe sometimes as a salvage procedure. Again, not a common daily occurrence that we deal with. Now, to your point, Sarah, what do we do to prevent the issues? Well, the one thing that we don't do is chronically use antibiotics or antifungal or anti-yeast medications in the ear. As you can imagine, like with so many other things, that can lead to drug resistance. One of the most successful things is using an appropriate cleansing agent. Now, I'm saying this, and there's a caveat. The caveat is that we have identified and addressed any underlying or predisposing condition that would lead to recurrent ear infection. So for example, if we have a patient who has allergies, then of course, we're going to want to manage the underlying allergy if we have any intention of managing the infections that the pet is experiencing on a regular basis. If we have, for instance, a dog that's, in the pool, 6 hours of every day during the summer, we're going to have to deal with, removing a lot of the excess moisture on a regular basis to prevent that from building up in the ear. And so cleansing the ear with a cleansing agent that typically adjusts, or in this case, lowers the pH, and something that has a solution that has a surfactant in it, something to sort of break up some of the waxy debris, is a very successful way of actually changing the environment in the ear. So it makes it harder for these yeast and bacterial organisms to grow. And I sometimes joke with owners who have Labradors that swim excessively in the summer that every day when they come in, we use the cleanser briefly to remove that excess moisture, so they're not coming in to see me on a regular basis with yeast infections. The same thing can be said with a dog that, take many of the Cocker Spaniels we see that already have sort of this predisposing issue with oftentimes having, challenging ear canals, for lack of a better phrase. Having these owners spend, 5 minutes, 3-4 times a week on occasion, cleaning the ears out can make a tremendous difference. Because again, we're looking to remove accumulations of cerumen, wax, or other debris. And at the same time, we're changing the environment, making it more difficult for the organisms that live there to really gain a foothold and grow out of control. We're not going to sterilize the ear canal. That's not possible, nor should we. I mean, those organisms likely have a role there, but we're trying to keep those populations at bay and let the body do its thing, otherwise keeping them under control. So using a cleansing agent periodically, again, that may be daily, it may be every other day, it may be a couple times a week, depending on the season, the pet, and the underlying condition. That's really one of the best ways that we have of managing this particular problem. Certainly, there are other types of what to call them, cleansing agents, enzyme-based agents that are designed to sort of, manage the bacterial populations. And, I'm going to say disclaimer, this is my personal opinion, but I've had so much experience with using the cleansing agent successfully that I've seen it work. To your question, Sarah, here about peroxide, no, peroxide is not something we typically use. To be honest, 3% peroxide, which is what you usually buy over the counter, just the bubbling and foaming and so forth could be a little disconcerting and uncomfortable. We're typically using solutions that have things like boric or acetic acid, different types of surfactants or emulsifying agents. So there's usually a mixture of compounds to do several things at once. I guess in a pinch, if you really needed to use peroxide, you could, but certainly one of the other things to consider is if you had a dog that had really ulcerated or irritated ear canals and you put the peroxide in, the heat generated in the bubbling could be a little uncomfortable or disconcerting. So it's not something that we gravitate to. And the same thing can be said for some of the solutions that contain the acids I mentioned. I mean, even though they're not extremely strong, in patients that truly have severely affected ear canals, where you get tremendous ulceration, sort of this rawness to the inner canal, you don't want to aggravate or irritate that. And that's why sometimes we will gravitate towards leave-in options, because when you have a painful ear, every time you approach your pet, you don't want them to fear you. You don't want them thinking, hey, she's going to go right after my ear and cause me pain or discomfort. They're not going to obviously conceptualize or understand the problem. This is where we may step in and, do more work for you in the hospital so you can do less at home. And it goes without saying, it certainly wouldn't be inappropriate at times to obviously offer up pain medications as well, perhaps even in addition to steroids to manage the pain and inflammation, at least for the first few days until we get the infection under control. And as I was saying before, depending on the medication we use, it might be anywhere from 5 to 14 days of treatment. But we do like pets to come back in. We like to make sure the infection is gone. It's a minority of cases that don't resolve the first time around, but when those cases do arise, we don't want them to linger. They're going to come back, sometimes come back with a vengeance. And again, it's painful, it's uncomfortable, it's unpleasant. None of us would want to be in that type of situation. So making sure the infection is gone, and in situations where we're not able to really look deep into the ear canal because of the inflammation and pain, it gives us another opportunity to do so to make sure we're not missing anything that could be problematic going forward. I'm sure that, if you did a search on Amazon, you can find other magic cures or preventatives and so forth. But if you look at the literature from the vet derm folks, cleansing the ear with an appropriate solution is really going to be one of the most effective things, aside from identifying any underlying conditions that have to be managed because they're contributing to the formation of these ear infections. So that's my shtick. I know Dr. Panna's on the phone, so I don't know if she's got anything she wants to chime in. Let me just look at the question. Have a cocker that has repeat fungus infection here, has food allergy tested, so now what? Well, I guess the first question I'd ask is, when it comes to food allergies, the gold standard for determining if a pet has an allergy is not testing. In fact, testing is basically considered to be completely unreliable when it comes to food allergies. The gold standard is what we consider or we refer to as an elimination trial or a food trial, where we use basically a hypoallergenic or an allergen-free diet. We feed that for a period of time. We basically give the body's immune system a chance to rest, and then we go back and we'll test individual ingredients, usually protein sources, to find out what they might react to in order to determine what we have to avoid. But food allergy testing in any form, whether it's done via blood, or I know there's some quacks out there who test hair samples for saliva. It's all bogus. It's bogus science, bogus testing, has little to no value. So that would be the first question I'd ask, is if the diagnosis of a food allergy is being made based on the test. And keep in mind that at least with respect to allergies, there are those patients that can have allergies to things both in the environment and to certain ingredients in food. Again, with the protein sources being the most common. So that's the question, one of the first questions that has to be answered. Then, of course, this being a Cocker Spaniel, I'd want to take a look in the ear canal and see if there's anything anatomically that could put this patient or make this patient more at risk for developing recurrent infections. But let's assume this was just, for example, a perfectly normal Cocker Spaniel who just got fungal infections, didn't have any allergies. Then, of course, we would probably be looking at using a cleansing agent of some type, perhaps one with a little bit of what's called ketoconazole in it to help retard the formation of these infections in the future. But if it's a recurrent issue, by all means, identifying the underlying cause is key, so that you don't keep experiencing the same problem over and over again. Sarah, does that kind of answer the question? Okay, will you let me know via chat? Oh, okay, good. Just want to make sure. Olivia, do you have anything you want to add, or anybody else have any questions that they want to?
I have a question. What is the most effective way to use the cleanser? To put the cleanser in and.
Right. So personally, when at home, I don't want people digging in the ear. I don't think you want to be digging in the ear with Q-tips or anything else. That's just a recipe for discomfort on the part of your pet and maybe disaster if something goes wrong. So for routine cleansing, oftentimes, I'll show owners, we'll take the solution, we'll squirt it into the ear, we'll massage those ear canals right kind of where the ear kind of comes out of the head, right at the base, for maybe 15, 20 seconds. And then we'll let them walk away and shake their head. And hopefully, okay, if we're vigorous enough with the solution and sort of the massage, we'll break up a lot of that debris. And when they shake their head, they'll remove it. And then we let the solution dry in the ear so that, again, it changes the environment, making it less desirable for organisms to grow. But, you don't want to be digging. They're going to resent you for it. They're going to fear every time you approach them. You're going to come at them with a Q-tip. So it's a really simple process to do so.
Yeah. Okay.
Excuse me. As far as how often, honestly, I don't think there's no one answer to that question. I think it very much depends on, the pet situation. For example, that lab that swims every day, I mean, easily 3-4 times a week, I think would be, reasonable considering the amount of time they spend in the water and the way the water would pool in the ear. If it's cooler weather, January, maybe you're only doing it once or twice a week. I mean, it really kind of depends. Obviously, we're going to look for, the least amount of cleaning that's necessary, just because it's easier on all of us. But there's no one set answer to that question. So,
okay.
Any other questions anybody wants to pitch? This, by the way, was not meant to be a whole hour like some of them in the past. So there's only so much you can say about ears. So it's just, Olivia, did you have anything you wanted to add?
Nope. Very good.
Okay. Well, if anybody has any questions, by all means, they can reach out to us. We'll put this on our YouTube channel as well. Yeah, I mean, the ear infections don't have to be difficult or challenging, but we certainly don't approach them with a one-size-fits-all policy, even though on the surface, it may look like they're all the same. Believe it or not, oftentimes they're not when you start looking under the microscope or looking at the underlying causes. And therefore, the approach we take with one patient may differ for another that, again, on the surface looks like it might be the same, but may actually be very different. So with that said, everybody enjoy your evening. Hopefully the storm doesn't hit us like it did Saturday, and stay well.
Thank you.
Thank you.
You're welcome, everyone. Have a good night.
Good night.